What's happening on the front line of the NHS's efforts against coronavirus then? There have been many complaints from frontline workers about a lack of protective equipment. The Health Secretary, Matt Hancock, tried to reassure staff this morning.
You know, our country really needs the NHS right now, and I admire everybody in the NHS, in social care, who is really rising to this challenge. One of the big challenges is making sure that they are themselves protected, and I'll do everything I can to get them the protective equipment that they need.
Well, Matt Hancock speaking earlier. How will tonight's developments be received by those who work on the front line? Joining us now is Dr. Batt-Rawden, the co-founder of the Doctors Association, and Donna Kinnair, General Secretary of the Royal College of Nursing. And I want to pick up with those comments from the Health Secretary in a moment. But let me first ask you both for your response to the message from the Prime Minister. Was that what you needed to hear? Donna Kinnair.
Absolutely. I think it's a very serious situation that we are in. And what we needed people to do is understand the seriousness of it and take action. So my expectation is that people are following the guidance, they are washing their hands, they are self-isolating. And it's important that the seriousness of the situation that we are in is told.
Dr. Batt-Rawden, we never actually heard the word lockdown from Boris Johnson, although it sounded as if he was going as far as he could. Was there anything missing from that for you? Was it pretty clear and pretty stern to you?
I think it was actually, Emily. Doctors have been concerned for a few days now about the mixed messaging, which you quite rightly highlighted earlier. I don't think saying to the public social distancing was really working. It clearly wasn't getting through. We had an A&E doctor speak to us at the weekend and said, I've just been putting young people who are critically unwell on ventilators all night. I've walked out after my night shift into the day sun and everyone is just out and acting as normal. What is going on? Why is there such a dissonance? So there has been some confused messaging. Doctors have been trying to campaign for people to stay at home, which I think should have been the messaging from the government. But actually, I'm in support of the decision that Boris Johnson made tonight. It's a bold decision, but I think it is one that will help the NHS. I just hope that it's in time.
You worry that it isn't? You think that this should have been earlier?
I think doctors have been telling us at the Doctors Association UK for some time that they are worried that the government is not acting fast enough. Certainly what we are seeing in the front lines, a lot of people are getting sick. A lot of people are getting sick very quickly. We're learning from our colleagues in Italy who, you know, very sadly are completely overwhelmed and doing their absolute best under awful circumstances. We absolutely need to learn from that, and I am not sure, and doctors are not convinced that we are, but we are where we are now. I think the decision has been made. We support that decision, and I do hope that it will now help us flatten that curve.
And Donna Kinnair, we heard the attempts at reassurance from Matt Hancock. Is there a hierarchy now of who gets the equipment and how easily that is filtered out? I mean, are your nurses getting this stuff? Because they're spending an awful lot of time with patients even before they're actually in further intensive care.
So I was hearing from my nurses that they weren't getting the proper equipment, which is why I wrote to the Prime Minister today, asking him to intervene to increase the number of tests for the virus for nurses, so that we can identify staff with possible symptoms of COVID-19 and understand whether they're infected or not. I also asked him to ensure that all nurses treating COVID-19 pandemic have access to sufficient personal protective equipment. And that is because we were hearing that there were certain parts of the country that had no access to masks or equipment. And we understood that nurses were trying to make some of these for themselves. Clearly, these are the frontline people that are going into people's homes. They're working on the front line in A&E, and they need proper protective equipment.
What do you mean making them themselves? What are they doing?
So we heard reports that nurses were using plastic bin liners, because they didn't have adequate supply of aprons. What we've understood today is that the Prime Minister and Matt Hancock has intervened to ensure that those supplies have gone to the hospitals that I had identified did not have sufficient protective equipment.
Sammy Batt-Rawden, in terms of the viral load now, are the hospitals still broadly coping? Are there people turning up there who shouldn't be, or who you would advise not to come into hospital?
So I think I would say if anyone doesn't need to come into hospital, please don't. Having said that, if you are unwell, we are still here for you. Of course, you know, you come in if you need to. We will take care of you. I think that message has been getting out to the public. Doctors have been telling us, particularly the last couple of weeks, it's almost like an eerie calm, particularly in busy areas like A&E departments that would usually be full on a Friday and Saturday night. And I think everyone is just bracing themselves for the storm, really. But yes, I do think that message is getting out, and we really do appreciate the public who are trying to help us. And
if you could say one thing tonight, one clear message to the public tonight, what would that be? Sammy, I'll start with you.
So I would say to everyone listening, we are doing our absolute best to help you. We know that this is going to get a lot worse before it gets better, but the NHS frontline is 100% here for you. We will come to work for you. You need to stay at home for us. So please follow the advice that the Prime Minister has now clearly laid out. Please stay at home. Please follow the advice and help us take care of you.
Donna, a last word from you.
The nurses are working tirelessly around the clock to protect patients, and we need our patients and public to do their part. And I would reiterate, wash your hands, stay at home, self-isolate when necessary, and we will be there to protect you.
Thank you both. Thanks very much indeed, and thanks for the work you're doing.